The Australian Institute of Sport is launching a female athlete research camp today to examine the impacts of periods and hormonal contraceptives on female athletes' health and performance. Dr. Rachel Harris is leading that project and she joins us now. Hi, Rachel. Tell us a bit more then about what you're investigating in this camp.
Yeah, thanks for having us, Ros. The AIS, so the Australian Institute of Sport, and the Female Performance and Health Initiative is part of that, as well as Australian Catholic University have come together with NRLW to have a camp that's investigating various aspects of female physiology, which include the impact of menstrual cycle on performance, but also different health aspects, including sleep, nutrition. We're looking at breast health, we're looking at pelvic floor health, and how that might impact athletes across a 5-week period. So we've actually been collecting menstrual cycle data on the 26 athletes that are involved for the last 2 months, and we'll be looking at how different menstrual cycle phases are impacted across that time.
And how important is it to understand these aspects of female athlete health?
It's so important. We absolutely know that the basics of health literacy in our female athletes are generally pretty low. We also know that, there's a lot of assumptions that are made about how the menstrual cycle might impact different aspects of performance, but we don't really know that to a great extent. Right. It's really important for us to start collecting this information so that our athletes can know more about themselves and how both positively and negatively they may be impacted across the cycle. We might find out that there's actually not much of an impact, but we really need to actually do this research and do it well.
And you say NRL athletes are taking part. Why that code in particular?
Yeah, we put out an expression of interest earlier this year, and the NRLW Indigenous Women's Academy put in an outstanding expression of interest. So we've got 26 Indigenous athletes from around Australia, as far north as the Torres Strait, coming together. The NRL is actually expanding their league to go out to 10 teams this season. So this was a great opportunity for this group to not only show themselves on the field, but also to learn more about themselves. And they're so passionate. NRLW have been doing and making great strides in the female athlete area for a number of years. And they were really passionate to have this group empowered about health literacy, but also push themselves to hopefully get picked up by one of the NRLW teams.
So potentially, Rachel, do you see these results having an impact on training regimes or other aspects of athletic careers?
Yeah, look, I think we'll start to see this. We've got 26 athletes that are being part of this camp. We absolutely need to collect a whole lot of information to be able to say that we've got definitive changes across the menstrual cycle. At the present time in the literature, we only know that there are really trivial changes. It's a very individualised thing, so we cannot say for the whole of the population that training will change or training needs to change. It's a very individual thing. We also know that women have very different impacts from their menstrual cycle. Women absolutely feel great at different times of their cycle, and others are really significantly impacted either from medical conditions or just from really quite significant symptoms across the cycle. We also know that there are a huge amount that are on hormonal contraception as well. So there's lots more to learn. We hope to start learning more about it, and hopefully down the track we will have some really good information to come out of it.
And has this been driven by the explosion in interest in women's sport in codes like rugby, football and so on?
Look, I think absolutely there's been a huge increase in the professionalisation of women's sport. It's definitely, I think, a time for all of this to change. The AIS has had this project since 2019. We've had researchers doing wonderful things in this space for a long time, but we also need huge amounts of money to actually be able to even track menstrual cycle data. It's a big cost because we do have a number of different factors that are implicated in that. We're just gathering this data now. I think because of the interest in this space, we've been able to bring everything together.
Rachel Harris, good luck with that. Thank you.
Thanks so much, Ros.